talk about what patients might be taking to replace opioids?
Yeah, so there's a few things that you could do. So for instance, if you have what we call neuropathic pain, meaning pain from the nerves, there are medications that are not controlled substances and not in the opioid family that you might do better with. They're going to specifically work on the action of the nerves and try to get rid of that pain. There's other alternative therapies that you could use, such as physical therapy. If you're recovering from possibly a joint injury, physical therapy sometimes is better than getting addicted to these pain medications. So we have other things. Lidoderm patches are great too for people who just have localized pain. So there's a lot of different medications we have, and I think as physicians we need to start using more of them. That way we can try to help them out a little bit.
Do you have patients that maybe are a little fearful of taking the opioids and they say, oh, I don't know, I'm scared?
Yeah, absolutely, and I especially see it with family members. Morphine, for instance, I think is a medication that's really scary to people because especially I think in the Cuban community, this was misused for a while. So yes, definitely, but I think that their fears are correct, and we as physicians have to look for other things.